Good morning, sir. I'm Euginia, Sympli, second year of medicine. May I know your name and age, please?
Okay, my name is I'm 21 years old.
So today I'll be doing the cranial nerve examination. Is that okay with you?
Okay.
First, I'll be doing the cranial nerve 1. That is olfactory, which is a sense of smell. I'll be giving you some things to sniff with your eyes closed and with your one nose closed. Okay. Close your eyes and nose. Tell me what it is, okay?
That is coffee.
Okay.
That is coffee.
Okay.
Toothpaste.
Okay, can you open your eyes now? And next, the cranial nerve 2, which is optic. First, I'll be doing the acuity test. I'll be using the Snellen chart, and the patient should be 20 feet away from the chart. Sir, can you read the last line which you can read?
Okay. DEFPOTEC.
Okay, so the vision is 20 by 20, which is normal. Next, the visual field, which is finger wiggle test. So let me know if you see my finger, okay? Just say yes.
Yes. Yes. Yes.
Okay. Now I'll be doing the optic fundi, which I will be using the ophthalmoscope. So you do use any prescribed glass?
Oh no, I didn't.
Okay, since you don't use any, then I'll start from 0. Can you look straight forward? Okay, I can see the red reflex now. Okay, so next I'll be doing the cranial 3, 4 and 6. That is oculomotor, trochlear and abduction. First I'll be checking the extraocular movement by using the cardinal sign. So please follow the tip of my finger. Okay. So there is no diplomia or asymmetry on both sides of the eye. Now I'll ask my patient to cover one of his eyes. Can you cover your eyes? Okay, tell me if you see my finger.
Yes. Yes.
Okay, the other.
Yes. Yes.
Okay. Next, convergence to check for the nystagmus and ptosis. Now please look at the tip of my pen. So there is no nystagmus or ptosis present. Now I'll be doing the cranial nerve 5, that is trigeminal. First I'll be doing the sensory. I'll be doing this pencil. This is the sharp end and this is the blunt end, and you have to close both of your eyes and tell me if it is sharp or blunt. Okay?
Sharp. Blunt. Sharp. Sharp.
Okay. So there is no detection of abnormal sensory loss. Next, the corneal reflex. Uh, I'll be using this cotton waves. Check. Can you look away? There, your eyes. Okay. So there is bilateral blinking on both of the eyes. Next, for the motor, uh, I'll ask the patient to clench his teeth. This is to check for the muscle contraction of a temporal region and masseter region. So can you clench your teeth? There is a normal contraction on both the temporal and masseter region. Now I'll be doing the cranial nerve 7, that is facial nerve. So there is no asymmetry or tics. Now I'll be checking for the sensation anterior 1/3 of the tongue. Also, I'll be putting something on your tongue and please identify it. Okay.
That is salt. It's coffee.
Okay. So the sensation of the tongue is normal. And now I'll ask the patient to raise his eyebrows. So can you do this? Frown. Can you close your both eyes tightly? Can you wrinkle your nose? Can you puff your cheeks? And smile. Next, cranial nerve 8, which is vestibulocochlear. First, I'll be doing the whisper test, which I will be closing one ear of the patient and whisper at the ear. So please repeat after me, okay?
1, 2, 3.
Okay.
1, 2, 3.
Okay. Next, the release test. I'll be using with this tuning fork, which is 512 Hz. Can you still feel the vibration?
No.
How about this?
Yes.
Can you still feel the vibration?
No.
How about this?
Yes.
Okay. So the air conduction is more than the bone conduction, which is normal. The last test, which is the Weber test. So can you feel the vibration equally on both sides?
Yes.
So the lateralization and localization is on the midline, which is normal. Now I'll be doing the cranial nerve 9 and 10, which is the glossopharyngeal and vagus nerve. I'll ask my patient to say ah. So can you say ah? The soft palate rises symmetrically. The uvula is on the midline and each side of the posterior pharynx moves medially. The posterior pharyngeal wall is intact. Next, cranial nerve 11, that is spinal accessory nerve. There is no atrophy or fasciculation in trapezius muscle. Now I'll ask my patient to shrug his shoulder upwards against my hands. So can you shrug? Okay. The strength of muscle contraction is normal. So can you look to the left against my hand? Okay, this side. So the contraction of a sternocleidomastoid muscle is normal. Okay. And lastly, the cranial 12, that is hypoglossal nerve. Okay. Sir, can you open your mouth? Okay, so the tongue of the patient lies on the floor of the mouth. Can you protrude your tongue? Okay, there is no asymmetry, atrophy or deviation of the tongue. Can you move your tongue side to side? Okay. There is a symmetrical movement of the tongue. Okay, so with that, I'm done with the cranial nerve examination. Thank you.